So the medication-assisted treatment program here at Algone, we use medications to help patients with their dependency, but that is not the treatment for dependency of alcohol and/or opiates. It is very important to be in counseling, and we do recommend once you start on this medication, the medication helps calm your brain so that you can then engage in the counseling part, which is the treatment part. Because the combination of the medication and the treatment will give you the best success for your sobriety. Patients don't want to be identified as an addict, so-called addict, but that's not what we do. So I have to go through the process of helping them understand dependency. Being on opioid medications for a chronic period of time causes changes in their brain on a cellular level, and how these medications are helpful for them. There are 3 therapeutics that are used in the United States to treat opioid dependency. The one that we've chosen to use at Algone is the Suboxone, which is a partial agonist therapy, and it helps patients who have, especially with opioid dependency, they have either cravings or tolerance that can occur. And so this medication, either an injectable form, oral form of medication, and when this medication is in your system, it settles on your opioid receptors in your brain, and it just calms those opioid receptors. The opioid receptors that we're talking about is the part of the brain that's been affected by chronic opioid use. Those receptors will cause tolerance and will cause withdrawal symptoms when opioids are not being used. And so the medication Suboxone just calms those receptors. The other medication that we use here is Vivitrol. Vivitrol is an antagonist to the opioid receptors in the brain. So what that means is that when a person has whether alcohol dependency or opioid dependency, those receptors in the brain will trigger and will cause the patient to either crave alcohol or opiates. When we use Vivitrol, it sits on the opioid receptors and it just calms them down. And so these are 2 therapeutics that we use here at Algone very well and very successfully. Yes, there are withdrawal symptoms associated, but we're not detoxing you from the medication. So the withdrawal symptoms for about 24 hours before we can start you on the Suboxone medication. It's a safer way to do that, because if you take Suboxone medication while you have opiates in your system, it will precipitate a much stronger withdrawal, and it's very uncomfortable. So we do advise our patients to withdraw from the opiates, meaning stop taking opiates 24 hours before you see me in the MAT program, and then we can start you on medications. Now, there are medications that are helpful for the withdrawal symptoms, and usually we have that discussion as well. The bridge device is a neurostimulatory device, and we place it on the ears, and it looks really cool because it has wires that we attach to your earlobe, and it's attached to a generator that sits just behind the ear. It's a little device, and what it does, it generates electrical impulses to the earlobe. What that does, it causes the neurovascular bundles in the earlobe to send messages to the brain. What that does is actually calm the brain down, so that if you are and when you are in withdrawals, which can be very painful, it can also cause a myriad of symptoms. Anxiety is one of them. Tearing, your nose is running, yawning, your muscles are aching, you feel nauseous, your abdomen is cramping. When we attach this particular device, within 10 minutes, all those symptoms are practically gone. What we usually do is we wait another 20 minutes, and we want to monitor your symptoms, we monitor your vital signs, we want your pain level, and we do something called a clinical opiate withdrawal scale, and that tells us where you are in your withdrawals. Within 30 minutes of placing this device on your ear, all your symptoms are gone, which is quite remarkable for someone who's going through withdrawal symptoms.